Thank you very much for those kind introductory words. I'm delighted today to be talking about what we teach and how we teach it in regarding values-based practice for undergraduate medical education. Next slide, please. I think the first thing to consider is why bother teaching students at all? And at the risk of preaching to the choir somewhat, I think I would want to use this infographic on the right, which I think really explains how evidence-based medicine was conceived and how it should be taught to medical students. We have a particular patient with a particular problem. We use the evidence gathered from all of our clinical research, and that forms the start of the filter, which we then put through our clinical expertise to work out which aspects of those should apply to that patient in front of us. Then we use values-based practice to incorporate the patient's preferences to make sure that we're able to come to a satisfactory shared decision with them, incorporating them in that process. And I think one of the criticisms that's been levied before about teaching medical students is perhaps they haven't been put into those scenarios yet where values-based practice is something that they are actively able to use, and thus some of the nuances may be lost in them. But actually, I absolutely refute this. And I think this is a fantastic opportunity to help us frame how they acquire the rest of the knowledge they learn over medical school, and how we teach sort of the rest of the syllabus, particularly the evidence-based medicine cohort, which sort of dominates the syllabus for the most part, and allows us to help shape modern practice through modern physicians. Next slide, please. So how do we do it? This is a great photo of illustration that I've borrowed from one of my colleagues, and it talks about the transfer of knowledge and how actually historically we used to think of it sort of like water or tea, to pour it into our students' empty vessels, and we just sort of chalk and talk and hope that they absorb it. But values-based practice is something far more profound and more complex, and something you can just lecture on. So we definitely incorporate them very thoroughly into the learning process through sort of audience participation. And the first thing that we do is we review the diversity and unpredictability of values within the room. And you have to remember that the students themselves are all studying the same course at the same university, and hence hold the same goals theoretically of becoming doctors. So in theory, they would not realize that they have such a diversity of values. And then we ask them to apply that to their patient cohort, which are exponentially more diverse. We relate it to clinical examples, and we have a group discussion for each one, and they tend to enjoy that bit. And then we try and incorporate the tutor's practice into it. So for example, as a surgical trainee, I certainly do a bit better with the examples in the surgical field, but we do try our best in other spheres as well. And I think moving back to that very top point is at the moment, undergraduate program is currently embedded in the Oxford syllabus in a couple of points, which I'll reference later, but it's definitely something we're looking to expand. Next slide, please. So the next thing to think about is what do they think about it? And it's important to differentiate between the content we deliver and how we deliver it. As I mentioned, it's very important that we deliver it in a way which is heavy audience participation, and we do our best to refine, and manage to improve year on year, I hope. But the content itself is something which I find usually depends on the students themselves and their ability to abstract and empathize, because there's maybe scenarios they haven't yet come across, particularly in their first year of clinical practice when it's first taught to them as part of their surgical modules. I find that students who have been patients themselves are often far more sympathetic and understanding, and tend to engage with it a lot better than those perhaps who haven't been exposed to it. And we do our best to repeat key aspects, through various parts of the sessions to try and stop that infographic on the right of mixed messages. And as I mentioned before, they do tend to really get into the clinical examples, and I definitely think there's a real utility in using those to structure the sessions. Next slide, please. So where do we go from here? It's been a fantastic first 4 years. We've embedded it in several parts of the syllabus. As mentioned, the surgical aspects have been very successful, and we've thus expanded it into professionalism, where it's in line with the GMC guidance, which the collaborating centre sort of helps with, and also end-of-life care, which is something which we've published on as a centre as well. Our ambition is to offer it to other medical schools in the UK at an undergraduate or postgraduate level, and indeed it's already taught in a variety of other faculties, so Nairobi University to surgical trainees of all levels, Singapore University across all manner of courses, with faculty at Leicester, and it's offered as part of a digital health masters at Warwick University already. Next slide, please. So in conclusion, I think values-based practice is a sort of an inspirational point for a lot of our students that we give it to, and indeed that's how I've been interested in it and how some of our other students have come to get involved in the centre as part of these undergraduate modules. It's really important, particularly in surgery for consent, as others have alluded to already with that Montgomery ruling, and something they really should and must understand before they leave medical school. And I think the most important take-home message is it really combines humanity as well as evidence-based medicine to solve issues for a specific patient, which is the essence of modern clinical practice. Next slide, please. So any questions, I'm more than happy to take them. And if you'd be interested in having a discussion about how we can incorporate and teach in your local faculty, your local medical school, we'd be more than happy to have discussions. Thank you very much.